I don't want to. I don't want to. What's up, D learners? It's your girl, Lady D of DTalford Training Solutions, here to talk to you today about the signs and symptoms of oppositional defiant disorder. So in my previous video, I talked about what is oppositional defiant disorder. So in this video, I would like to talk to you about some of the signs and symptoms that go along with having oppositional defiant disorder. Because if you're starting to feel like someone in your family, someone in your classroom, someone in your life could potentially be an adolescent that has oppositional defiant disorder, you want to seek help for them, for yourself, for anybody that's in that child's life. Now, a good way to get started with that is the Vanderbilt assessment. So you can find these online and print them off and fill it out. You want to take it with you to have it scored by either a psychiatrist or a pediatrician. Some of them will score it for you, or a developmental pediatrician, but you definitely would like a medical professional to help you with the true diagnosis. I am here just to educate you on some of the signs and symptoms so that you know what to look out for in children in your life. So let's get started with some of the behavioral symptoms. So easily losing one's temper. So that could be throwing repeated temper tantrums. Now remember, when we are talking about kids that could be as old as 15, 16, or as young as 5 or 6, where we would expect a 2 or 3-year-old to throw a temper tantrum, but by this age, they should be regulating their emotions better. Always seeming to want to argue. They want to argue and go against what the adult or authority figure wants them to do. Sometimes you'll see fighting, refusing to follow rules. So it could be rules of a game with their peers. It can be social rules in society, just refusing to follow the fact that there is a rule. Deliberately acting in a way that is annoying to others. So when you think about oppositional defiant disorder, think obnoxious. This is that obnoxious kid that annoys the heck out of you, that gets on your nerves, and it seems like they do it completely and utterly on purpose. Blaming others. It's never their fault. Something is always because somebody else did it to them. Blatantly hostile to others. Being unwilling to compromise or negotiate. So typically around the age of 4, kids understand that there are some things that their parents or teachers will let them get away with, and that there's other things that they cannot. And they know which things to keep pushing for and which things that they have to negotiate or compromise on. And typically, if around 3 or 4, most kids are socially and cognitively able to compromise with an adult. Willingly destroying friendships. It seems that they cannot seem to get along with any other kids. Other kids always seem to be upset or unwilling to want to be friends with them. Being spiteful or seeking revenge. So because it's always someone else's fault, because someone else is always doing something egregious to them, they are vindictive, spiteful, wanting revenge. Blatant and repeated disobedience. So some of the things that you might see cognitively with these kids are frequent frustration, difficulty concentrating, and failure to think before speaking. So that failure to think before speaking also goes along with one of the comorbid disorders that can go along with oppositional defiant disorder, which is ADHD, where they have impulsiveness when they're speaking. So this is not so much the impulsiveness piece of things, but this is more the not being able to think before they speak, because what they have to say is compelling them to say it. So they have that compulsion. I have to say it. I have to say it. So there are certain criteria that the psychiatrists will use in order to diagnose a child. Some of those things are the behavioral patterns. So this has to be going on pretty consistently for more than 6 months typically. And you're looking at angry or irritable mood. So what kinds of symptoms are those? That's, again, the losing temper. Oh, that kid seems touchy. Why are they always so easily annoyed? Why are they seem like they're angry, resentful, vindictive? So that also is argumentative, defiant behavior. So what does that look like? This is the kid that's having frequent arguments with authority figures or adults, actively defying requests from anybody in authority, refusing to comply with requests, deliberately annoying others. Again, that obnoxious kid, and blaming others for misbehavior. Now, what is vindictive? That's acting spiteful at least twice in a 6-month period. Now, these behaviors will disrupt the child's life, and it's not necessarily, it can't be linked to something else. So it's not linked to substance abuse, depression, bipolar disorder, or a psychosis, even though they can run comorbid or together, as well as some other disorders like conduct disorder, attention deficit hyperactivity disorder. So there are mild, moderate, and severe symptoms of oppositional defiant disorder. Usually it's mild if it's only occurring in one setting. It's moderate if it's occurring in about 2 settings, and more severe if it's 3 or more settings. So oppositional defiant disorder, you definitely want to think about, is this child throwing repeated tantrums? Do they typically want to argue? Are they always refusing my requests? Are they frequently blaming others? Are they having outbursts of anger or resentment? They seem touchy. They seem easily annoyed. Are they spiteful? Are they maybe even swearing or using obscene language, saying mean and hateful things when they are upset? So think about children in your life. Are you seeing this? Are you noticing this? Is this something that you want to bring to a medical professional and get more advice about? Just remember, train up a child in the way they should go, and when they are old, they will not depart from it. You are the most important person in a child's life. It is up to you to help them reach their potential. Please like this video, share it with a friend, and subscribe to my channel for more information about diagnoses that you could see in early childhood.